Hello everybody, I'm Dr. Aarthi and I'm here to talk about the modified OXIS classification for primary anterior teeth. Primary dentition can be an open or a closed type. Although open type being most favorable, it is not uncommon to find a closed type of dentition. The variations that could occur in the type of spacing, contact, or crowding cannot be completely overlooked. Previous studies have reported variations in the presence of interdental spacing and primate spaces being present only in maxilla or in mandible. A study done on Nigerian children reported 18.1% of them to have contact or crowded anterior segment in both arches. The studies have summarized the anterior segment as those with generalized spacing with only primate spaces or those with crowded anterior segments. Primary canines are present in the oral cavity for a prolonged period of time. However, studies on the prevalence and pattern of decay are very minimal. One study reported the labial surface to be the most commonly affected in primary canines, while the other reported multi-surface caries affecting the primary anterior teeth in 3 to 6-year-old children, including the primary canines. Thus, it is likely to postulate that the position of a tooth in the arch and their contact with the adjacent teeth could play a significant role in the initiation of caries. Absence of interdental spacing and crowding could increase plaque accumulation, thus increasing the risk for caries. Knowledge of the different types of contacts present in primary dentition could aid in long-term follow-up and prevention of caries. Studies done by Cortes et al. And Kritika et al. And Muthu et al. Have paved a strong foundation to find out the different types of contacts that could possibly exist between other primary anterior teeth. Primary canines are the last to exfoliate in the oral cavity and thus are subject to various environmental influences. Clinicians face the challenge of restoring primary canines that are affected with multi-surface tooth decay. The proximal surface of these teeth are affected along with their labial or lingual surface, adding on to the complexity. A thorough understanding and assessment of contacts could solve the unanswered questions. Thus, the aim of this study was to assess the variations in interproximal contacts of primary canines in 3 to 4-year-old caries-free children, and thereby modify OXIS and propose a classification for primary canines and other primary anterior teeth. This was a retrospective study design where the models of 3 to 4-year-old children who were part of another epidemiological study was used. Interproximal contacts of primary canines of 1,090 caries-free children were analyzed. Models with clearly visible contacts on at least one side of the primary canines were included. Models with unrecorded or broken canines were excluded. The models were viewed from the occlusal aspect. Retaining the OXIS classification, a few modifications were done to incorporate the variations in the primary canines. For X and I type, the contacts were scored buccolingually using a Williams probe. For the open type, the criteria was the proximal surface of the primary canine have no contact with the adjacent teeth, given a score of 0. X type, there is a point contact of less than or equal to 1 mm between the proximal surface of canine and that of the adjacent tooth and given a score of 1. I type, there is a surface contact of more than 1 mm between the proximal surface of canine and that of the adjacent tooth and given a score of 2. The S type was subdivided into two categories, type 1 and type 2, based on the number of surfaces being in contact. Canine is rotated and only one of its surface touching the adjacent tooth, then it is given a score of 3. S type 2, when canine is rotated and two of its surfaces are in contact with the adjacent tooth, given a score of 4. 4,674 contacts were considered eligible, and the open type of contact was the most common prevalent contact, followed by X type, I type, S type 1, and S type 2. Interarch comparison revealed significant results where there was a significant difference in the rate of occurrence of contact between the maxilla and mandible. O-type and I-type contacts were significantly greater in maxilla, while the others were significantly greater in the mandible. Proposing a classification should be simple yet comprehensive, and that which allows for categorization and differentiation. Thus, this study has extended the OXIS classification for primary canines that could be used for other primary anterior teeth as well. The modifications done to OXIS were the cutoff value set for X and I type contacts was set at 1 mm for the primary anterior teeth as opposed to 1.5 mm in primary molars, keeping in mind the buccolingual dimension of the primary anterior teeth. The second modification was that the S type was subdivided into type 1 and type 2 based on the number of surfaces of canine that were in contact with the adjacent tooth. In maxilla, the O-type contact in the distal region were more as opposed to mesial region, which was in contrary to the concept of primate spaces. However, in the mandibular arch, 88.5% of O-type contacts were seen in distal to canine, which was in concordance. There was no significant difference when considering the gender variations. The strength of the study include the large sample size and also the models that can be used for caries risk assessment in future. The limitations include the unrecorded teeth in most models present mesial to canine and the lack of generalizability. This study on the OXIS contact as a risk factor for proximal caries shows that S and I-type contacts had higher odds of developing caries. In our study, highest complexity was found in the S type 1 and type 2 contacts, where the canines were being rotated. Such a complex position could inhibit the cleansing activity, leading to plaque accumulation. Hence, it is plausible to hypothesize that the teeth with broader contacts and rotated teeth could be at a higher risk for caries formation. The knowledge of the type of contact could aid the clinician in re-establishing the contacts. Teeth with I-type, S-type 1, and S-type 2 contacts could need broader proximal restorations. This study was conducted in primary canines to evaluate the variations in contacts, which can be extended to other primary anterior teeth as well. Long-term follow-up studies are necessary to evaluate the association of these contacts with occurrence of early childhood caries. These are my references. I extend my sincere thanks to the team of Sree and the head, Dr. M.S. Muthu. Thank you.